afternoon, Soros from Alabama, Mississippi, and Tennessee. This year we are focusing on two aspects: Medicaid expansion, COVID 19, and updates on booster shots. Many years ago, there were many in Alabama who were in favor of expansion of Medicaid. Each time, none of them came out. Of course, there is a history behind Alabama not being able to expand it at a certain time. What we are looking at now is, in light of COVID-19 and all of the other health issues we're facing, there were legislators on the Democratic side who presented most of the bills for Medicaid expansion, but those bills never reached the calendar to be picked by rules. A few may have gotten out of the Health Committee. But as we move on, those bills will continue to be advanced in the Alabama House of Representatives.
Good evening, Saraz. I am attorney Deborah Hendricks Gibbs from Jackson, Mississippi, state representative for District 72, which covers parts of Hinds and Madison counties. The state of Mississippi did not entertain the idea of expanding Medicaid services. In this legislative session, there was a push, but not strong enough, to change the mind of the leadership to provide additional medical care in hope of saving lives of pregnant women who are currently on Medicaid. Those who are pregnant and eligible for these services receive 60 days postpartum after birth. Senate Bill 2033 would have authorized and directed the Division of Medicaid to provide up to 12 months of continuous coverage postpartum for any individual who qualified for Medicaid as a pregnant woman to the extent allowable under federal law. This bill was passed by the Senate. However, it died on the House calendar. The chairperson did not take up the bill for passage. The Mississippi Department of Health stated this bill was necessary since deaths in the state of Mississippi as a result of pregnancy are almost twice as high as the rest of the country. 60% of deliveries in Mississippi are funded by Medicaid. A common misconception is that active labor is the only risky stage of pregnancy. The department declares 86% of the state's maternal deaths occur after giving birth, with 37% of those deaths occurring after 6-week postpartum. When interviewed, the leadership regarding not expanding Medicaid or giving these services to pregnant women, the statement was that they did not want to expand Medicaid services. They don't want to put additional people and give them additional services. They want to get people off of Medicaid.
I am State Representative Barbara Cooper, representing District 86, Memphis, and part of Shelby County. Voting matters. I truly believe 300,000 citizens would have health care today had the Tennessee General Assembly accepted the Affordable Care Act. The Obamacare Act is worth fighting for. Voting matters.
Cases, hospitalization, and death from COVID-19 have declined greatly in Alabama. The Center for Disease Control and Prevention, CDC, recently announced a change to community levels from the previous community transmission, streamlined public knowledge about which and when individuals should consider masking. The guidance for isolation and quarantine, however, did not change. Isolation and quarantine help protect the public by preventing exposure to people who have or may have had a contagious disease. These practices have resulted in reducing the number of people infected and the number of deaths from COVID 19. To simplify guidance, the CDC has developed a new COVID 19 vaccine and isolations Q&I calculator. The CDC states that this online mobile friendly calculator provides an easy to use way to help people follow CDC quarantines and isolation guidance and get customized information to address their unique situation. In closing, I recommend that you get booster shots, and those who have not had those first shots should begin with those and just be careful and be cautious.
COVID-19 in Mississippi. As of April 7, 2022, total Mississippi cases 795,613. Total Mississippi deaths 12,410. COVID-19 community level is a new tool to help communities decide what prevention steps to take based on the latest data. Levels can be low, medium, or high and are determined by looking at hospital beds being used, hospital admissions, and the total number of new COVID-19 cases in an area. Take precautions to protect yourself and others from COVID-19 based on the COVID-19 community level in your area. The National Centers for Disease Control and Prevention recommend protective steps against COVID-19 in your county. COVID-19 community level low. You should stay up to date with COVID-19 vaccines. Get tested if you have symptoms. COVID-19 community level medium. If you're at high risk for severe illness, talk to your healthcare provider about whether you need to wear a mask and take other precautions. Stay up to date with COVID-19 vaccines. COVID level high. Wear a mask indoors in public. Stay up to date with COVID-19 vaccines. Get tested if you have symptoms. Additional precautions may be needed for people at high risk for severe illness. People may choose to mask at any time. People with symptoms, a positive test, or exposure to someone with COVID-19 should wear a mask.
Today, COVID-19 cases have risen to almost 300 from 26 cases yesterday, reported by the Centers for Disease Control. If you have not been tested, had your shots, and are booster, it's time to receive your second booster. Be responsible. See about your health today.